Cardiac assessment. It is a focused assessment done for cardiac problems or patients with cardiac diseases. So you should make sure you should follow your institution or hospital guidelines along with this assessment. So important aspects of cardiac assessment. As a nurse, she should be a good observer. So observation plays a very important role in the assessment. Be as objective as possible. When you find any problem, you have to check it with the proper tool to identify the problem or existence of the problem. Report your findings and do a clear charting for your safety. Articles needed. A clean tray should contain wristwatch, stethoscope, sphygmomanometer, ruler, inch tape, pen and a paper. Anatomy of the heart. I don't want to go detail into that, as you all are aware of the heart anatomy. In physiology, I should focus on these terms. Cardiac cycle is a systole and a diastole, that is contraction and relaxation of the heart. Stroke volume is amount of blood pumped by the ventricle per beat, and cardiac output, amount of blood pumped by the left ventricle per minute. So when you want to calculate cardiac output, you have to multiply stroke volume into heart rate. Preload, the volume of blood left in the ventricle at the end of the diastole. After load, that is systemic vascular resistance, the amount of resistance the ventricles have when they to open the aortic valve. So this is nothing but the amount of blood in the ventricles after the diastole or just before the systole. Cardiovascular assessment. The steps. As usual for all physical examination, we need some basic biographical data or demographic data, which includes name, age, sex, patient's address, marital status, occupation, income, and what is the diagnosis and date of admission, patient admission, and time of the patient admission. Along with that, we will collect history. When you collect history, you should focus on cardiac related problems like current health history. You will identify the common signs and symptoms of the patient with cardiac problems. And then past medical history, you should focus on any problem patient has related to cardiac problems like cardiac diseases like hypertension, history of hypertension, hyperlipidemia, and is he on any medication. So along with past medical history, medication history is a very essential one. Family history, you should focus on the hereditary diseases which runs in their family. Personal history, you should focus on the habits like lifestyle habits, exercise, sleeping pattern, smoking and alcohol. So modifiable risk factors can be focused in the personal history or while collecting personal history. We'll move on to general appearance. So once you enter into the patient's room or near the client, you should start your physical examination or observation. You just watch the patient for whether he is lying quietly or restless, whether he is lying flat or in a Fowler's or upright position. How is his facial expression? Does he have a pain or distress? Or there any signs of pallor or cyanosis in the face? So before starting the assessment, you should start doing the observations. So basic information. Here I am discussing the cardiac assessment with head to toe. You can do it like inspection, palpation, percussion and auscultation also. Here I am discussing the physical examination or cardiac assessment in a head to toe manner. So basic information includes general appearance of the patient like body build, consciousness, orientation. When you ask patient a question, you can ask which is something related to time, place and person. So you will know the patient orientation is with time, place and person, like what is the day now and where is he and who is this person next to him. So body posture you have to check. With that you can identify patient is having pain or breathing difficulty, and height, weight and BMI should be monitored. As same like other assessment, vital signs plays a vital role here in cardiac assessments. It is like temperature, pulse, blood pressure, heart rate, respiratory rate, SpO2 and pain. But we will be focusing here something related to the cardiac blood pressure, both hands, standing, sitting and lying. So make sure the patient's condition when you do this. So usually blood pressure should be checked on both hands, standing, sitting and lying. Pulse pressure, when you check blood pressure, you have to calculate pulse pressure, that is systolic minus diastolic blood pressure, which is normal is 30 to 40 mmHg, and pulse pressure increases with anxiety, exercise, bradycardia, hypertension, fever, etc., and decreases with shock, heart failure, hypovolemia, mitral regurgitation. So when the pulse pressure widens, it indicates shock, heart failure, hypovolemia and mitral regurgitation. So mean arterial pressure, that is MAP, should be calculated when you do the blood pressure, which is calculated by a formula called 2 into diastolic blood pressure plus systolic blood pressure divided by 3. So this is why you need a pen and a paper to calculate the pulse pressure, MAP, to write down the vital signs, etc. Pulse points. So pulse is essential for the cardiac assessment. So it should be checked for its rate, rhythm and quality. So it should include carotid, radial, brachial, femoral, popliteal, posterior tibial and dorsalis pedis. So when you check the pulse, you should check for the pulse point and give a grading. So here my grading scale has 0 for absent pulse, 1 plus for thready pulse, 2 plus for normal pulse and 3 plus for increased or moderate pressure pulse, 4 plus for full bounding pulse. So you should grade your pulse, and sometimes the external may ask you for the grading. So when you check pulse, you should able to grade it. These are all the common signs and symptoms you will witness in your cardiovascular disease patients, like chest pain or chest discomfort, palpitations, syncope, fatigue, dyspnea, cough, weight gain and edema. We will move on to the assessment. Here skin and nail are the first and foremost. So you should check the skin for temperature, texture, warmth, turgor and clubbing of finger. Cyanosis, here is a picture which shows peripheral cyanosis and this is central cyanosis. And splinter hemorrhage, the nails will have strikes of red strikes which indicate splinter hemorrhage, which is seen in infective endocarditis patients. Capillary refill is checked by pressing the fingertip for 1 second and release it, and the blood will return within 2 seconds. Normally within 2 seconds. If it goes more than 3 seconds, in case of dehydration, peripheral vascular disease, hypothermia and shock. So this is a picture which shows about the clubbing. Clubbing is usually seen in cardiac, renal, kidney disorder, renal and liver disorders. So make sure what is your patient's problem. So this is the clubbing, and this is how we check the clubbing, by keeping the both thumb finger, and it will show a diamond shape. If not, it indicates clubbing. Eyes, you will look sclera and conjunctiva for signs of anemia. Xanthelasma, yellowish plaque around the eyelids. So this is the xanthelasma which indicates the patient is hyperlipidemic. The next one is arcus senilis. So senilis is senile, which indicates the degenerative changes, that is a grey ring around the iris. So this is commonly seen in old patients, but if you see it or identify it in your client, it indicates there is possibility of hyperlipidemia, which is called arcus senilis. Next we'll move on to neck. Neck, you will see thyroid for the enlargement, carotid artery bruit, you can hear it by the bell of the stethoscope. Carotid pulse, you have to take a full minute carotid pulse and compare it with the apical pulse. So we say you have to calculate pulse deficit, which is calculated by apical pulse minus carotid pulse. The next is JVP measurement in neck. For this you need to keep the patient's head in 45-degree angle. This is jugular venous pulsation, and see for any JVP, that is jugular venous pulsation. If the pulsation is absent, you can write absent. If it is present, then you will measure it with a scale. So jugular venous pulsation is measured by keeping a scale vertically at the second intercostal space level, and when you see a pulsation, and you can measure the height. So you can use the ruler and the inch tape for the measurement. But make sure you keep the ruler from 0 to 10 like this. The next one is chest. In chest inspection, you will look for lesion, scar, mass and pacemaker. And in palpation, you have to keep your hand or palm on this place like the picture showed, and you will look for precordial heaves, visible or palpable pulses, and you will check the apical pulse by keeping the palm in the fifth intercostal space, midclavicular region. So the auscultation points, there are 5 areas you should listen for. Aortic area, second intercostal space, right sternal border. Pulmonic area, second intercostal space, left sternal border. Erb's point, that is left sternal border, third intercostal space. Tricuspid, fourth intercostal space, left sternal border. And mitral area, fifth intercostal space, mid-clavicular region, where you hear apical pulse. This is a mnemonic which is used for the students to keep for an easy reminder. All people enjoy Time magazine. A for aortic, P for pulmonic, E for Erbs, tricuspid and mitral. Normal and abnormal sounds. S1, the closure of mitral and tricuspid valve, best heard in mitral area. S2, closure of pulmonic and aortic valve, best heard in Erbs or pulmonic area. Murmurs are heard when there is turbulent blood flow within heart. When the patient is having regurgitation or stenosis of the valves, you can hear the murmurs and gallops. Gallops are the abnormal sound here when there is a filling of ventricles. Pericardial friction drop, which is caused by a pericarditis in case of inflammation of the pericardial sac. In abdomen, you will look for abdominal aortic pulsation, which is visible, bruits with the help of stethoscope, bell. Hepatojugular reflex. So how will you check hepatojugular reflex is, you will keep the patient's head upright like 45 degree height. Apply pressure to the liver. Just below the liver you can give a pressure. Observe a raise in the JVP. So the positive result indicates sustained raise of 4 cm. In most of the patient it raises and comes down gradually. So it comes down gradually, but positive indicates inability of the right heart to handle increased volume of blood. The next is Allen's test, which is performed to check the radial and ulnar artery blood flow. For this you have to ask the client to clench the palm tightly, and you will hold both the arteries with the thumb, and you will release one thumb and ask the patient to open the arm or the palm, and you will see the blood flow. Okay, this can be repeated by closing the ulnar artery and releasing the radial artery. Homan's sign, which is an indication of the presence of deep vein thrombosis. It is widely considered as unreliable, but all the physical examination it is included. So dorsiflexion of the foot indicates severe pain on the calf, which indicates the presence of deep vein thrombosis. So the summary includes, we have seen baseline data, history collection, what are all the general appearance or basic informations to be collected from the patient, vital signs, skin and nail, eyes, carotid and neck examination. In chest and in carotid you will look for JVP, and in chest are inspection, palpation and auscultation, and in abdomen hepatojugular reflex, extremities, Allen's test and Homan's sign. Hope you understood. Thank you.